We've seen a very low number of cases over the weekend, just 22 on Sunday. Does this mean that we could start seeing an easing of restrictions soon?
Thanks for having me. I think it's probably too soon to say we can ease restrictions because we have to, as you've heard again and again, this is a daily and weekly watch that we're on. We have to see how the epidemic curve looks and how sustainable this slow spread of the disease is. So it's probably difficult to say if we can lift the measures, but as you know, I think social distancing would have to be maintained for a little bit longer until we can ensure that there's no ongoing or sustained community transmission and we are able to stay below a threshold so our health system is not flooded and our vulnerable populations are protected.
Do we have any better idea yet of what it means for someone who's recovered from coronavirus that if they have an immunity and how long that would last?
We don't actually know how long the immunity will last. We know that people who have recovered from the infection do build an immune response. We are starting to see that evidence emerge from studies in China and other parts of the world, and we don't think that there would be any reason. We don't know yet if a person would be reinfected. So we think that they have an immune response. But again, this is, as we all know, we're learning on a daily basis, and we don't know how long the immunity would last yet. So it's probably too soon to say that, but we think that those people are immune. They've developed an immune response, and they are protected and safe to go back into the community, keeping social distancing and hand hygiene measures as a precautionary measure.
So what's the risk if we do ease off on the restrictions too soon? Would we see just the same rush of cases as if we hadn't had the restrictions in the first place, or are there additional risks?
Absolutely. I think the risk is still there. As long as we have cases in the community, if we lift all social distancing measures and remove all public health response measures, including contact tracing, we have the risk of having a resurgence in the case and a rapid increase, and we'd be back to square one. So, you know, as long as we have cases in the community, in the world, we have to maintain a strong public health response to be able to contain, trace and contain any case and any small clusters as rapidly as possible.
So do you have any idea how long this might have to last to keep coronavirus under control in Australia?
Look, I think it's difficult to say how long it would last. I think what we are seeing now is promising. Our case numbers are lowering. The number of cases, new cases that we're seeing on a daily basis is not as high as we saw initially, partly because the initial increase in Australia was related to return travellers. With the new quarantine measures, I think that's starting to have impact, but also the communities had a huge role in adopting the social distancing measures. People have stayed at home, and I think that's really helped in reducing the number of new cases we're seeing per case. So essentially a slower spread, our reproductive number is looking good, so to speak. So, you know, we think that at the moment each infected person can infect another 2 to 3 people, but if we reduce the number of people that we are coming in contact with, then we also slow the spread. So there are a number of things that would have to be considered before we can say the social distancing measures can be lifted, including population immunity, whether we have a good response in place, etc. But I think it's difficult to say how long it'll last. I think we also have to keep in mind that we are going into cooler weather, and winter, as a general rule, we see increased transmission of respiratory viruses like influenza, RSV. So we have to also be mindful that, you know, going into winter, we could see increased circulation of other respiratory viruses, including coronavirus. So there are a few different considerations at play before we can say that these social distancing measures can be lifted completely. But the slow spread is optimistic that we can see fewer and fewer cases, and we'll be able to break the transmission chains in the community.